Tanya from Created Health, Nutrition and Fitness. As a clinical nutritionist, I have a lot of people come to me with concerns around cardiovascular health and atherosclerosis. So I thought I'd like to present to you some information around heart disease and atherosclerosis. So what is atherosclerosis and why is it so hard to say? Anyhow, what it is, it's when the blood vessels, now remember our blood vessels carry oxygen and nutrients to various parts of the body. So when our blood vessels, known as arteries, that carry those nutrients to the heart and then to other parts of the body, it's when those arteries become stiff or thickened that is known as atherosclerosis. So I suppose now the next thing is what causes it and what can you do to prevent it, or if you have it already, what can you do to reverse that and get the blood and nutrients and oxygen flowing freely through your body. So interestingly, there are more than 200 risk factors for heart disease and atherosclerosis. So if you want to look at all 200 yourself, feel free to. There is a paper called Lipid Risk Factors and Ischemic Heart Disease. It's in the Journal of Atherosclerosis, and it was published a little while ago. It was July 2096, but there are over 200 risk factors for heart disease and atherosclerosis. So if you don't want to read all 200, there are three main causes of it, and they are smoking, hypertension, known as high blood pressure, and dysregulated or abnormal lipids. So what are abnormal lipids? So this is quite interesting because when we look at it, in order for those lipids to be dysregulated, there are 15 different types of cholesterol contained in your lipid proteins and 4 different types of triglyceride-rich particles which make up your lipids, and it's a combination of those in an incorrect combination which creates those abnormal lipids. So there's a lot involved with actually having abnormal lipids. So I suppose what are our preventative measures in regards to heart disease and preventing atherosclerosis? So the first thing that you want to do is quit smoking if you are a smoker, and this is going to have twofold. So first, we know if we quit smoking, that's going to take that risk factor away. And then second, if you quit smoking, that's also going to assist in lowering your blood pressure, which is the number 2 thing. So that's quite interesting, and we know that if you can reduce your blood pressure by even 5 to 6 mmHg is the measurement that they use, which is a measurement of mercury. So if you can reduce your blood pressure by at least 5 to 6 mmHg, then that will reduce your risk of stroke by 40% and coronary heart disease by 14%. So it's a really good benefit to be able to reduce your heart rate. So they're the most important things. The other thing that you can do to reduce heart disease and atherosclerosis is look at having a nutritionally balanced diet. Now, when it comes to diet and research, the majority of the research that has been done around diets is predominantly the Mediterranean diet, and because there is a plethora of research around the Mediterranean diet, it is then the most recommended diet to have. And interesting, when you do go on the Mediterranean diet, the most common vegetable in that diet is garlic. And I did say vegetable. A lot of people thought that it's a herb, but garlic is actually classified as a vegetable, and it's part of the onion family. So then when we look at garlic, this is quite interesting as well, because there is evidence that garlic has been around since the beginning of history. So they found garlic in Egyptian pyramids, in ancient Greek temples. There is reference to the use of garlic even on clay tablets dating back to 2006, between 2006 and 2100 BC. So we know garlic has been around for a very long time. There is evidence that garlic was fed to the athletes during the earliest Olympic Games in Greece, and that was to improve their stamina. So I suppose you could say garlic was the first sports enhancing or performance enhancing drug that there ever was. We know that garlic is used as food and also as medicine since ancient times. The Egyptians used to use garlic to increase the stamina of their workers, as well as with the Olympians, they would use that to increase their stamina for their performance as well as the Egyptians used it for resistance of infection. A lot of people are aware of the immune qualities of taking garlic, and externally garlic was used as to prevent wounds becoming infected. We also know that even when we look at biblical times, back in Numbers 11 verse 5, where the Israelites were wandering around in the wilderness, they complained about not having the garlic that they had been able to consume when they were being held as slaves and captives by the Egyptians. So it's quite interesting when you look at the history. It has been around for a very long time. Roman time it was used. China has record of using garlic, and India used to there's Indian texts where they recommended garlic for heart disease and arthritis. Interesting, garlic has a plethora of vitamins and minerals in it. So we know there's vitamin A, C, E, B complex. If you have fermented garlic, your riboflavin and vitamin E is actually enhanced. So that's been, all of those vitamins have been detected in garlic. Also, when we look at the essential trace elements, we know that there's zinc, manganese, copper, selenium, iodine, soluble and insoluble fiber. So, and we know that with soluble and insoluble fiber, that has plasma cholesterol lowering effects as well. So the most studies report the health promoting effects of garlic for being cardioprotective. Even when we look at studies, there were 10 studies that were done on animals and 11 studies that were conducted on people, and both the animal and the human research that was done confirmed the lipid lowering effects of garlic. There was also other research done on garlic in regards to raw garlic having a profound effect on lowering glucose as well as cholesterol and your triglyceride levels. Many research papers have been reporting that garlic possesses plasma lipid lowering and plasma anticoagulation and antioxidant properties, and it improves the blood vessels in the body so that endothelial function in the body. So garlic has lots and lots of really good properties. Just remember though, if you are scheduled to have surgery and you are taking garlic as either a supplement or consuming it naturally in large quantities, make sure that you stop taking your garlic at least 2 weeks before any operations or surgery. So hopefully this has encouraged you to start adding garlic to your meals and look for ways where you can incorporate garlic on a regular basis, because remember, it is good for our heart and good for our health, and at the end of the day, our health is our wealth.